Hey Sarah, so you've come in for a visit to the doctor today?
Mm-hmm. Yep.
Great. And so tell me a little bit about um what's going on.
Yeah, so I just had my first baby. And I'm just feeling like I don't know, like I'm not feeling the mom role. I don't think I'm connecting with the baby very well. I just don't feel like I'm as excited as I should be being a first time mom.
Okay. Yeah. Um, so if you don't mind, let me just ask you a couple of questions here. Are you feeling um uh, can you go a little bit more into what you're feeling? Um,
Yeah, I feel like I'm irritated all the time. I'm like constantly just like thinking about the like worst case scenarios, and I just feel sad all the time and
yeah.
angry, and I just don't feel like I should feel this way. I feel like I should be happy about being a mom, and I just feel extremely overwhelmed, and my husband is trying to help me, but he's driving me nuts.
Yeah.
So
So
I don't know, I just
how's your sleep?
not not very good.
Okay.
It's either I sleep way too much or I sleep really little.
And what did your doctor say? Have you talked to your doctor about this at all?
No, not really. I just a little bit, just mentioning that like I feel like I'm just not as happy as I should be.
Okay. So I do have a couple of quick questions for you, and I'm going to kind of breeze through these questions to see if we can get a better understanding. It sounds to me like this might be something like postpartum depression. Have you heard of that before?
Yeah, just a little bit.
Okay. And so in the past 7 days, have you been able to laugh or see the funny side of anything?
Not at all.
Okay. What about looking forward to enjoyment of any things?
No, I just feel like I don't know, there's no looking forward in this moment.
So when things go wrong or like things don't go perfect, do you feel like you blame yourself or other people, or how does that?
Yeah, I feel like I blame myself
Oh,
more than anyone else. I just don't feel like I'm doing a good job.
okay. And have you been anxious or worried for things that later you think are not a valid reason?
Yes,
Okay. And is that a lot, a little bit, sometimes?
a lot, I would say.
Okay. Um, so yeah, so and have you felt scared or panicky for reasons you don't think are very valid later?
Yeah.
Okay. So, and this again, this is in the past 7 days. So,
Mhm.
um, uh, so another question is have things been getting on top of you? Things that you're not able to control. Do you feel like you're losing control of stuff?
Yeah, I feel like I'm not able to control.
Okay. And you already mentioned that you're not getting much sleep and it's caused you to be unhappy. Um, and how unhappy? Would you say sad or miserable or just a little unhappy?
I'd probably say somewhere between sad and miserable.
Oh, okay. What about crying? Does it, push you to like more emotions where you cry?
Yeah, I cry randomly for sure.
Okay. That's, it's a lot of times, I guess it would be, the question is that more than normal?
Yes.
Okay. So, and what about thoughts of like hurting yourself or the baby?
No, no thoughts of hurting the baby. Not really of myself, just like when I get super frustrated, I go to that, but not, I feel like nothing too serious, I guess.
Okay. And what does that look like for you if it's nothing too serious?
Just like a passing thought in my head
Okay.
of like maybe I'd be better off kind of thing, or
Okay,
they'd
well,
be better off.
And then later, do you feel like shocked that you feel that way, or does it feel normal for you?
Not necessarily shocked, just more like I pushed it under the rug.
Okay. Well, that's really good to get that kind of feeling for where you're at. I am sorry that you're feeling that way. And what I think we should do is just really start looking at some therapy and some sessions, and maybe talk to a doctor about getting some meds so that we can then help you with that. How does that sound?
Yeah, that sounds great.
Perfect.
Hi, Michael. Thank you so much for coming into the doctor's today. I just kind of wanted to check in and see what brought you in.
Well, I'm just having some reoccurring thoughts of, we just had our baby, and I'm really scared of my thoughts, but I think they are probably the right choice of either, hurting myself or hurting my baby. And it just seems off.
Could you tell me a little bit more about those thoughts and what they contain?
Well, I've been acting a lot differently lately. At least that's what my partner is telling me, that since having the baby, um, I just I've been doing random things. I'm not the same person. Like when my partner talks to me, I just don't look at them the same. I don't view them. I just kind of hear them, but I don't connect emotionally when they say they love me and everything. I just feel like, I don't know, just numb to it.
Hmm.
And it's the same thing when I see my baby. It's more of a shock that it's there, and this is a cruel world we live in, and I don't know why
Yeah, that
I
sounds
should be here with the baby.
yeah, that sounds like you're going through a lot. And you had mentioned before that you feel like those thoughts are correct. Kind of expand on that for me.
Well, it's just this horrible world we live in, right? I mean, there's a lot of bad stuff, especially if you even pay halfway attention to the news. And I'm just really down and depressed. And sometimes I see the news and it makes me so angry. And then I just get really numb afterwards, like I'm not even in my own person anymore. And again, a lot of this is what other people are telling me too. My mom's telling me this, my husband's telling me this, and I just
Mm.
don't feel, and I feel that way. I feel like, you know, hurting myself. I've had depression in the past, but this seems different. And, I occasionally in the past I've had the thought of, committing suicide, like more of like, what would the world be like without me? But now this is a shitty world. I don't care what it would be
Mm.
like without me. I don't want to be here, and my baby needs a mother. And if I'm not here, the baby shouldn't be here either.
So I'm just gonna reiterate what you said and correct me if I'm wrong. It sounds like you're feeling a lot of numbness, but
Yeah.
also it's coming from an observation from the outside. Like some of the ways you're acting, you don't even notice that you're acting those ways. It's coming from outside observers.
Yeah. And like when the baby cries, it kind of bugs me. I don't think I want to take care of it. I think I just want to just let it go. And then my husband kind of sees that and he runs over and takes care of the baby. And it's just a really weird feeling. So they thought I should come in and
Yeah, well, I'm glad you did come in. Um, I first want to mention that like what you're feeling is totally valid, and I'm super happy that you're here to talk to me about it. How have you been sleeping?
off and on. Sometimes I'll sleep a ton, and other times I will not sleep at all, no matter what. And so it's only been a few days, but like I think it's been like 2 or 3 days, and I might have gotten an hour or two of sleep.
So it sounds like to me either you're having a lot of energy or no energy.
Well, it's not even energy. My mind is racing, my thoughts are racing, and I'm just not
Okay.
there. So,
With those thoughts racing, is there any paranoia that you're feeling?
well, yeah, again, like when I read the news and I just like the world is so evil that I'm waiting for something to happen. And so why not just stop things from happening or take control of it myself? And so, yeah.
Okay, yeah. So based off of kind of what you've described, I don't think it's postpartum depression. I that is a common one that most people hear. Have you heard of that before?
I have, and that's what they think I have. And the doctors mentioned things like that or baby blues when I told the doctor about it. But um, then I talked to my old psychiatrist, and they're a little bit more concerned that it could be something else. So I thought I'd come in for this and chat with you.
Yeah. Well, I'm glad you came in. I think we'll obviously do some more tests and deep dive into it a little bit more. That will kind of be our game plan. But based off of this conversation with the confusion and the paranoia and it sounds like kind of the obsessive thoughts that you're having, I am kind of leaning more away from postpartum depression and more towards postpartum psychosis. And in our next session and our longer sessions, we'll kind of go into a little bit more detail on that. But as of right now, I think a good game plan would to be getting you on some medication and kind of see if those make you feel better. Does that sound all right?
Sounds great. Thank you.
All right, perfect. See you next time then. It was great to meet you.